All this started, this concept of thinking differently about medicine started in the 60s. Antibiotics were discovered in the 40s. It was introduced in the 40s. And already within 20 years, it started giving a lot of complications. Then they started, this was in the 60s, during which they had the hippism, and we want to think alternative. We don't want to do what medicine tells us to do. So there was a great movement going on in the world, especially started in London to start with. And then what happened was that the thalidomide incident came in. Women were taking medicines for nausea and vomiting, and a lot of children were born with horrific deformities. Now that led to a lot of complications, and people started saying, we want holistic medicine, we want alternative medicine. But what happened in the 70s is that Nixon took a group of doctors to China on his first visit, and there they showed operation on somebody's stomach without anesthesia, just with acupuncture. So he came back and he says, this is fascinating. He said that we must accept this acupuncture thing for anesthesia. So then homeopathy came up at the same time, which started in Germany, of course. So as a result of that, people started calling this medicine complementary medicine. That is not alternative, which is very aggressive, complementary medicine. Then in the 80s, that's when I come into the picture. I did my medicine and did my MD, and then went on to did my post-graduation in acupuncture, went back to India, learned, Ayurveda, Unani, all sorts of things. Now, when doctors, that's when I coined this word integrated medicine. When doctors go on to study all these alternative stuff, all these complementary stuff, they can't call themselves complementary because they're used to certain language, certain things. So when they practice this sort of medicine, then they are integrated medical physicians. This is the difference. Now, let's go back to business. Now, you see all these strange type of diagnosis that they do, you see. So, pulse is measured by these three fingers. I want all of you to feel your pulse. So this is the index finger, the middle finger, the ring finger. So place it just below the thumb on any of the hands, and just close your eyes for just 2 seconds, and you'll see the pulse beats very vigorously under one of the three fingers. Okay? All right? Just remember which finger. Now do the other side. And you may have noticed that it has already changed. The finger, the pulsation has changed. Why is it so? Why is it so? Pulse, if medicine was to say that pulse remains the same. So for thousands of years, they have been studying it. It was there in Greek medicine, Chinese medicine, Indian medicine, the pulse. So now, on the left hand, let's start with the right. On the right hand, how many of you felt maximum pulse in the middle finger? And how many in the little finger? So you see, already within yourself, there's a difference. So the middle finger means you've got a lot of acid in the stomach. That shows a lot of acid. Similarly, you can diagnose a lot of things. Pregnancy, if a woman is pregnant, if she's having menstrual period, if you have fever, if you've been drinking less water, or if you have been very tired, or you are suffering from insomnia, you have high blood pressure, low blood pressure, like that. In the 1930s, 14 qualities of pulse were taught to doctors. Now, you go to a doctor and say that, they won't even take your pulse. They'll put your finger into an instrument, and that will record the pulse. Why within our lifetime? When you were children, you went to a doctor, the first thing the doctor did was to look at the tongue. Why is it considered, dirty or irrelevant? No, there's a point. They say, oh, you cannot measure these things. Well, by the way, who measures headaches? Who measures backache? Who measures impotence? Who measures infertility? Who measures insomnia? On a scale of 1 to 10, you see, okay, I'm insomniac 5 or 6. But nobody can measure these things. So not everything has to be measured by science. Physics, chemics, mathematics. They want to measure everything. And because they can't measure, So it doesn't exist. Now, what I'm trying to do is to bring back these old systems. I've trained 7 batches of National Health Service doctors. I've trained doctors or therapists in all these spas, because mind you, in all these spas, there's going to be a crisis in 15 years when medicine starts to question, insurance companies start to question that what is going on in these spas. You know, see, already herbal medicine is banned in UK. Such wonderful herbal medicine, even things like echinacea, this, that, which every household use, is banned 2011 because of European pressures. What is going to happen to that? So we got to start preparing ourselves in having a standardized form of training and treatment. Now, in integrated medicine, I'm not blowing my trumpet, but because I coined this word in 1982, and what, what is the principle of integrated medicine? The principle I take not from a Chinese medical system, not from Ayurvedic medicine medical system, but a European traditional medicine, the Greek medicine, the medicine of Hippocrates. Hippocrates said something very interesting, that every one of us, I mean, and nature and planets, they have a healing power within themselves, the innate healing power. All of you are looking for answers about environmental changes and all that. This is the aberration of that healing power. Something has gone wrong, and the environment has gone sick. That is the problem. So what is it? So if you get a cut, how many times have you cut your fingers? Where are the scars gone? If people have had fractures, you go and have another X-ray after it's healed. You can't even find the scar tissue. It's healed so perfectly well. So old fractures can never be diagnosed by medicine because they heal so perfectly. You burn your hand, you have a flu. If you cure it, you get cured in 7 days. If you don't, in a week. So basically, it's the immune system does the job. Pregnancy has become such a major issue. Gynecology, this test, that test. It is the most normal thing that you can ever have. Pregnancy, for a woman to get pregnant. How many women are infertile now? So something has gone wrong in that system, even this simple system of reproduction. So I have taken that system of Hippocrates, that there's an innate healing power present in nature, in plants, in animals, in us. Okay, that which heals. So what he said was that the whole of medicine is not like rocket science. In those days, there was no rocket science. It was based on logic. Plato, Aristotle, they all based their assumptions on logic. They didn't have science to measure this, measure that. So basically, what you needed to do is to stimulate this innate healing power. Just as this healing power heals the cut in your fingers, it has got the capacity to heal 80% of the diseases. This is what Hippocrates said in the island of Kos, 2,500 years ago. And it is so true now. I do realize people need surgery, emergency medicines, and the new age medicines, well, cancer, this, that, were always there, but they're becoming more prevalent. So 80% of so what did Hippocrates say? That you got to do 3 basic things: eat well, exercise, and have some sort of physical therapy like massage. And so the concept of spa grew up in the center of Rome. There's a huge spa. What did they do there? The Greek spas, the Roman baths, and the Roman spas, salus per aquam. So treatment through, in translation, treatment through water. You see, they went into different types of water, whether it was steam baths or sauna or hot pools, tepid pools, cold pools. This is all used to stimulate. So you ate and drank, but in the evening or during the day, you found time to go to these spas. That's where you did the continuous thing. So the whole concept of spa is a wonderful thing. Not only does it cut medical bills, but it has got the capacity to heal at least 80% of the diseases that we have, especially fatigue, chronic fatigue syndrome has become so common. Headaches, fatigue, constipation, irritable bowel syndrome, all these, aches and pains, backache, arthritis, osteoporosis, all these things can be treated by just three simple things. Now, what I did was, I mean, I've been doing my programs in the Himalayas because I knew that I had to create my own system of spa. So I did a lot of experiments there. I used to take blood and study what happened. But I must say that I used the altitude to enhance the body's immune system and the healing power. That's because, when you're getting used to the oxygen, you generate more cells. But this process also gives a push to all the other systems of healing. That's why, sportsmen and all these people, they train at altitude for fitness. So I use that technique. Now, basically, what did I do? I had my own type of diet. But the most interesting thing is that digestion, which is the most powerful part of the system of nutrition, takes place in the acid medium in the stomach and alkaline medium because of the bile and pancreatic juice in the intestine. So I had to just regulate the acid and the alkaline, not in the blood, but in the intestine. And the magic happened. This I realized over a period of time. I said, this is a major thing. Less gas, no constipation. Of course, you have to eat slowly and control certain things and make sure that you went to the toilet regularly. And this was very important. And the system of massage. So what I did was I used two types of massages. One is Marma. It's an ancient system of Ayurvedic massage. It was used by martial arts. So if you were hit at a particular point and the limb went paralyzed, there were antidotal point with which you can revive. I did two researches in hospitals in London, major hospital, Hammersmith Hospital, and in Exeter, where I used this technique to treat stroke. People who were paralyzed on one side. So this Marma, and the second thing was this, that I accidentally discovered about 25, 26 years ago, that the brain has two types of circulation. One type is through the carotid, and the other type through a pair of arteries. I've got the model there, but I didn't want to show. I wrote a book called The Neck Connection. And it goes inside the vertebrae. It's very well protected in a canal. So you see, I began to wonder, why does the brain have two types of circulatory system? And then the apple fell on my head. Yes, conscious brain came in much later in evolution. Subconscious brain, the reptilian brain, was there forever in reptiles and things. So because we have a new brain, we had new circulation. So I started studying the role of subconscious brain, how it changed everything from emotions to your healing power, and so I started, believe me, 30 odd years I've been practicing medicine, and with some very serious people, and serious families, and I probably use 10% of medicines. Everything that I do in my spas, I do even in my clinic in London, except that the massages, they have to keep coming back, to have the massage. So that massage of feeding the subconscious brain, the main center for healing, the main, the pituitary, the hypothalamus, the limbic system, where the emotions are thought, by feeding it, getting more blood. You send more blood to an organ, it's going to function better. Send more blood to the heart, it's going to improve its quality. To the muscles, it's not going to get lactic acid and cramps. So the massage was used, diet, massage, and I replaced exercises with yoga. We all know that, yoga is for the physical and the mental. Does anybody have stuffed nose now? I'm just going to show a few. Come up here, please. 1 second. And anybody with frozen shoulder, because I need to demonstrate, that's it. Anybody with frozen shoulder, who can't lift the shoulder or anything, come up here, please. No? You want to come? Okay. Now, here's what. Take a deep breath in. Stop. You stop and you do shallow breathing now. 10 seconds. Breathe out. Stop. Breathe in. Stop. Breathe out. Breathe in. Stop. Half a breath. Breathe out. Breathe in. Stop. One more. Breathe out. Breathe in. Stop. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay. Now breathe. Just breathe normally. Do you think it has cleared up? So what did I do? Now for thousands of years ago, yoga knew this. Okay, can go back. Yoga knew this. Now what really happens is that when you retain carbon dioxide in blood, right? In response to that, all the blood vessels, they dilate. The brain thinks, oh my God, my master, my mistress, my mistress has gone crazy, holding her breath. Oh, open up all the windows, all the doors, so that more air can go in. So you're tricking the body. I use that. And not only me, look at these Tibetan monks who go over the high mountains from China and they escape to India. They have just a shawl, a chatouche or a Kashmir shawl, woolen shawl, and they carry their barley powder, and for 3 months they work. They sleep on the ice just by practicing this breathing. So this rotation, they might, like here, she was probably breathing 4 times in a minute, but actually, in actual fact, if you reduce your breathing to once a minute, you go into a hibernative stage where you're warm enough, you're sweating, and you're sleeping on ice. So this is nothing. So there are so many different things. Unfortunately, I have developed techniques, unique techniques of backache. Anybody has a backache? Quick thing. Come up here. Okay. Which side is your backache? That's it. How long have you had that thing? Do you mind if I touch? Okay. Okay. So basically, it's very painful. I touched one point. I'm not treating her back, by the way. I'm not treating her back at all. Compared to this side, it's unbearable, isn't it? Just give me. So there is a point which you press and you release the back. I'm not talking about herniated disc, sciatica. You have to do that. But for common backache, why can't we, all these spa therapists, and hopefully with Anne and Elizabeth, we will have a training school so that we have unified. There's fighting going on. Somebody's criticizing hot yoga, this yoga, that yoga, God knows how many types of yoga, how many types of Ayurveda, something in southern India, the land of the gods, and God's own land, and Kerala, and somewhere else doing all. What's this? You got to unify. The storm is coming. You got to prepare yourself with unified training of yoga, that which works. I know how it will work because I've been training doctors, and many of them are professors and all that. Okay, straighten up. All right, just walk and see if there's been any relief whatsoever. See, I didn't touch her back. You saw that. Like this, by touching, by no, it's not. You need to do that yourself as well. So over the years, over 30 plus years, I've developed so many new skills which doesn't require medicine. And it's not that you're going to be treated, the problem with all this complementary medicine is that there are too many of them because there wasn't much regulation. And there isn't a common language, the British school will have something else, and the Indian school will have Chinese tuina massage and Thai massage. There's so many different things. But you have to get all that together to make it user-friendly, cheap to train, and cheap to apply. And for that, you really don't need if they have massage degrees, that, I'm ready to accept them. Okay? But they need to be all trained in the same thing. I know we have energy medicine. I know we need to do infusions. I know, leave it to choice. But the central core part of all the healing programs that you give. Look, I spent a lot of time. I'm one of the first doctors who, having been an excellent, gold medalist student, have gone into this. It took me just one step. First, I became a convert and then a fanatic, like everybody else. So, with that, I end my sentence.